Do you have dark hair and light skin like me? Well, that could lead to some complications for your hair transplant. Explain that, Steve.
We talk about Steve's pet peeves. This is one of them. There's nothing wrong with your dark hair. As a matter of fact, I'm always saying I'm jealous of David's hair. I love the dark hair. I mean, come on, like dark hair, any color skin. It's the coolest hair. A contrast is challenging when it comes to the art, and that's what it is, of hair transplantation. David, now I'm going to throw him under the bus and say he was bald. I mean, he was not like, he didn't have like hair in the front. He was bald. So David's result was uniformly done over the series of a few procedures. So David's dark hair, light skin isn't as much of an issue as someone with what looks like what I call like a mohawk in the center. Like in the old Roman gladiator movies, they had like this helmet on that had like this brush on top, kind of goofy looking. Like some guys have this massive amount of thick hair in the very center, and these huge areas in the corners that have no hair. You're looking at this white face and this white head that almost looks like a bald guy in the front, but then there's this massive amount of center core hair. Those are very challenging hair transplant. We all know that you can only place this hair so close together. The grafts can only go so close. And we can debate that back and forth and about doctors and this and that. But the most important thing to understand is, yes, the doctors that we talk about, specialists, board certified, full-time staffs, those are the ones that are going to all place them approximately exactly the same spacing together. Dark-haired, light skin, especially the younger men and women, of course, but they don't bald that way. And they are researching, they're like, hey, I choose you guys. So how many grafts do I need? Okay, 2,500 grafts. And then the surgery success. You can see the after photo. Every single graft is as close as it can be. The hair transplant has never had a chance to be successful when you compare it to that center, huge mohawk area. It's never going to be as thick. Now the result comes in at 12 months. The patient actually forgets what he looks like.
And he's like, hey, it's kind of thin.
Exactly. Kind of thin, sir. You didn't have any hair at all. 2 procedures. What I tell patients is you should plan for 2 procedures. It doesn't matter male, female. It doesn't matter gender, race, or age. You should plan for 2 procedures. And that's just a heads up because, of course, exactly what I just said, you can only put the grafts so close together. When it comes to dark hair, light skin, especially if the patient is a man under 35 years old, you are going to need 2 procedures because there's no way that any hair transplant doctor in the world is going to be able to match the density in the center core. When you look at the doctor's work, you do not want to choose one. You do not want to choose 1 or 2. You want to look at 25, 30, 100 examples. And you want to be able to say, hey, this one doesn't look as good as this one. And that is a key. That's actually good. So if you think that's going to happen, and any doctor is going to fill those areas with that black hair, I use Pacific Rim Asians, men, and pale white skin, whiter than mine. Good luck. It's not going to happen. They're going to look much better. It's not going to look transplanted. They're going to be happy, but they're probably going to come back and say, I wish it were a little thicker.
If you want to get a closer look at what dark skin on light hair looks like after multiple hair transplants, I shaved my head 1 year after my last hair transplant, and this is the video right here.